Hey guys, welcome back to the channel. My name's Sanchit, I'm a psychiatry trainee in the UK.
I'm Varun, I'm a radiology trainee in the UK.
And today's video, we're going to be watching some of the more interesting medical scenes from one of the most loved medical shows, Grey's Anatomy.
Never seen Grey's Anatomy.
Nor have I.
Oh, have you not?
This will be interesting.
Okay, let's get him back. Where do we need to load and go?
Seattle Press is slammed, so they're diverting us to Redmond, but that's an hour away, and this kid... He doesn't have an hour, Jackson, he doesn't.
All right. How are his vitals?
Bad. We've got no airway. I can't cry. He's got sub-Q emphysema. He will die en route. If we have to go way out there, he will die.
Are you asking what I think you're asking?
If I am, will you do it?
What's she asking?
I've literally
have no idea.
I feel like they've glossed over the fact that they don't have an airway.
What's he asking?
I don't know. Because she said, I can't crike him, so that means kind of putting a hole in his throat and putting a tube in, so you're kind of bypassing that bit of the neck. So what could she possibly be asking for?
So she can't get an airway in,
Yeah.
like through the mouth. She can't get a crike in, which, like you said, it's a tube into the trachea. So then, what are your options?
Honestly, I've got no idea.
Let's find out.
On up now, let's go.
Unexpected.
I was not expecting that. I don't think Grey's Anatomy is supposed to be a funny show.
It was so serious, the music.
Yeah.
Banged
into the door.
It's not even one of those like fully glass doors where you can't tell that it's a door. She walked into like the metal bit in the middle.
Imagine that happening to you on your first day in the emergency department.
Yeah, you're trying to be really helpful. You like run to the door to open it.
Oh no.
Oh, jeez. I'm okay. That's why we needed interns.
Door won't open.
Watch the IVs.
Hurry.
April, what's going on?
I don't know. Jackson? Jackson!
Starting to give.
Also, why is the door not opening? What is it? This show is already wild.
Added a bit of drama in it.
Yeah.
So you have to call MedReg. At this point, you call the MedReg.
I mean, they're an A&E.
Call MedReg?
In a good A&E department, they should be managing their own emergencies. I have definitely worked in emergency departments where they don't.
Yeah.
Sometimes, fine. If you need help sometimes, you're busy, whatever, then fine. But on the regular, to not handle your own emergencies, as the emergency department,
Yeah.
I don't think it's acceptable.
But it does happen that the MedReg gets called for
Everything.
just random things. I know there's
The
stories
door's
out,
not opening.
There's stories out there where there's like a pigeon on the wall and they
Yeah.
call MedReg being like, what do we do? It's like, well, I don't know.
I've had a bleep like that. Oh, there's when I used to work on the wards. Oh, there's a bird in the ward or something. Initially, I was confused. And then it took all my kind of patience. Like, why are you calling me? I was like, I just said, oh, call security. I don't know.
Yeah. I don't know what they want.
And security would be like, why are you calling me?
Call the doctor.
What do you want me to do? Knock this pigeon out? I don't know.
Oh! We need to do rapid sequence intubation
I
stat!
can only get a 20 and a 22 gauge in the field.
I'll start a central line. I need some lactated ringers.
On it. I can see the cords. Paralytics are working. All right, I need an ET tube. Orange drawer. Orange drawer.
I knew that.
No chest sounds on the right. I have to throw in a chest tube.
I think I saw betadine somewhere.
Wait a second. Does anybody actually have chest tubes?
I'm trying to set up this saline.
The drawer that you saw with the different colours, that's, I assume, a crash trolley. And they have them on every ward. And, you know, if there's a cardiac arrest or an emergency, you wheel that on. It should have everything you need for an emergency. They'll say to you as the F1, like, oh, grab me X. And you'd be like... and they'd be like, it's in the yellow drawer. You're like, yellow drawer? Yeah. But yeah, I mean, it seems pretty realistic. It can get pretty chaotic. And often you'll say... Well, sometimes you'll say, grab me a chest tube like he's done.
Yeah.
And there's... not one, so then you just make a face, run off, try and get one.
Then someone has to just go run and get one.
Yeah.
Incoming! Lights.
They're doing it in secret, aren't they?
Why are they doing this? I think we've missed some of the scene.
I think it's because this hospital has diverted patients away. And so this is just like a secret little A&E.
I think we've not
happening.
seen the prelude to this.
Yeah.
And we don't know why they're doing this.
This hospital's diverting patients, the next hospital's an hour away.
Oh,
Yeah.
okay, and this kid's not well and they're not going to make it to the hospital.
Yeah. So it does happen. A&Es will divert patients away if they're just way too busy because it becomes unsafe for a patient to be brought there.
Well, first of all, why are they on divert if they've got an empty room? That's the best thing.
all this equipment, all these doctors,
Yeah.
and an empty room in the salon divert.
When I've seen them divert, I've been in departments where they diverted before, and it is bad. Things are dire for them to divert. They don't divert very easily. When I've seen them divert, there's been patients, recess is full, majors is full, which is one step below recess. The corridors are full.
Yeah.
Ambulances lining up because the paramedics come to the hospital and they can't usually hand over patients, i.e. leave the patient, without handing over to like a nurse or a doctor or somebody. So then the paramedics are waiting in the corridor. That means ambulances outside are backing up.
Yeah.
And because there's ambulances waiting in the hospital, there's then no ambulances in the community. And the whole situation is just, like, honestly, well, the one time I was there and the diverted, it was ridiculous.
All clear.
Son, get in here. We need some more hands. This kid died because you brought Red along on some lame idea of a date?
They ride along with a date? I need some 4x4s to control bleeding on the scalp.
All 3 lines are patent. We can start dopamine at 5 mics per kilo per minute, but we need to figure out his IV drip rate. It's different for kids depending on the size. So anybody have a calculator?
I always ask a nurse.
Not a real nurse.
Froslo tapes is 30 kilos. Standard concentration of dopamine is 1600 mics per cc. So 5 times 30 is 150 times 60 minutes an hour is 9,000. Divide that by 1600. Infusion rate is 5.625 cc's per hour.
Whew. I'm going to assume she's right. That's quick maths.
Quick maths, that. Quick maths. She kept it secret though. She was like, oh, shall I say it? Shall I let them know my secret?
Also, why are all these people really good looking?
Grey's Anatomy, innit?
That's the only thing I've heard about Grey's Anatomy, because I've not seen it before, is that all the doctors are super good looking.
Yeah. That's what it is like in the UK, obviously, you can tell.
Yeah, obviously. I used to work with a guy like that.
A savant.
He had like an affinity for numbers.
Yeah.
So patients obviously have their name, but then they also have like a unique identifier, like in the UK, so your NHS number or you get a hospital number. And you need those numbers to find results on the computer systems, because obviously there'll be 20,000 John Smiths. So it gets a bit annoying to like go on the computer, log into the system, and then you have to look at the number from a piece of paper you have and type it in. You just say to him, oh mate, what's Mr. So-and-so, what's his NHS number? Just knows off the top of his
Really?
head. Yeah,
Oh, mad. NHS numbers are long.
mad. You know, if you're watching, you know who you are.
There's no time. Cahill's on our way down here right now.
I'm staying. Parked outside.
Okay, go.
Move, guys, move!
Hurry!
We gotta get this thing mobile. What happened?
He's readying down.
We gotta keep moving.
I'm not getting a pulse.
Well, start CPR.
Damn it, his trachea is deviated to the left. His sats are dropping. I think it's a tension.
Go on, Sanchit. Let's test your medical knowledge. His trachea is deviated to the left. What do you think's going on? And he's desaturating.
Pneumothorax. Tension
Oh,
pneumothorax.
still got it. Still got it.
Still got it, mate.
Well, that's
Not too high in psychiatry yet.
yeah, true.
It's only been 2 years out of medicine.
Yeah, it's a bit of a joke, isn't it?
Yeah.
When you get a call from the psychiatry consultant, it's a bit of a joke that they're going to ask you something and
Yeah.
you're going to be like, why are you asking me this?
They've not done medicine for,
Yeah.
like, as a consultant, minimum 6 years.
Yeah.
But yeah, man still got it.
What if he dies? What if I brought him here and what if he dies?
Before you go in there, I'd like to,
Okay, right this way. And watch your step, please.
I think, I mean, obviously I can't speak for everyone, but I think most people have been in that situation where there's that voice in the back of your head. Slight, I don't want to say panic, but like, oh crap, what if?
Yeah. And I think it increases the more senior you get. As an F1, you're very rarely going to be doing anything or in charge of anything which could end up killing someone.
Yeah.
More senior SHO level or reg level, where you're really doing stuff that could actually end up leading to some significant harm happening to a patient. I think being a consultant, especially for practical specialties like interventional radiology or surgery and stuff, to just stand back and let someone else do something, knowing that they don't know how to do it as well as you can do it, and knowing that if they mess up, you're going to have to fix it. And they could mess up in multiple different ways. It's not like this one thing that could go wrong. Anything could go wrong.
Yeah, I don't think that's going to be fun when it gets there.
No, definitely not.
We'll see.
never seen.
Okay, I understand you might be thirsty, but I'm sorry, you cannot drink beer in here.
Wasting it. I was just showing these guys how when I scrunch up my eyebrows, the knife moves. See?
Oh my god!
Whoa,
No,
don't do that.
Stop!
Lovely. Never seen that.
No, I've never seen that.
Okay. You guys should have seen the brawl. Stu Ball kicked that other guy's
Okay, and now Stu Ball has a knife in his head. Okay, let's focus. Stuart, how much is 14 plus 4?
18.
27 minus 13.
15?
No, 172 minus 16.
I have no idea.
What are these hard questions? I can't do it that quick.
Yeah,
I'm
that's
not
pretty
even-
difficult.
Yeah, I've not got a knife in my head.
It's not because of the knife. It's just because I'm so drunk.
No, actually, it's just because he's dumb.
Thanks, David. Really?
Unbelievable. His mental status is completely intact.
You don't count for his math skills.
It's like the knife did no damage at all.
So why don't you just pull the thing out? Because we got a games to get started. I'll drink to that.
No beer!
Uh-oh. No. Hey.
How many do you have?
This guy's an absolute joker.
Do you reckon they've called a neurosurgeon yet?
One of these lot's probably a neurosurgeon.
Do you reckon? Because that's what you need. You need a neurosurgeon.
In
I
these
assume.
American shows, they're always like 6 different professions.
True.
Like, one of them probably is a neurosurgical specialist.
Yeah, true.
Look,
You should be out of surgery any minute.
good. As long as that thing stays in there, the higher the risk of infection or abscess formation.
He's about to... Holy crap. Oh my god.
Okay, that... I don't even know what to say.
If he just died now,
Yeah,
would he get done for manslaughter?
probably.
He wouldn't.
I mean, I'm not a legal expert,
Yeah.
but I would assume so.
Yeah.
Interesting.
So, now can we get out of here?
He looks like Fred Flintstone.
He did that, didn't he? Yeah.
Maybe it's the same actor, I don't know.
And have plenty of fluids. Not beer. Not beer.
Will do, Doc.
There is no way on earth you walk into A&E with a blade in your head, your mate pulls it out and you get discharged the same day. It's just not happening.
We're no neurosurgeons, but I find this hard to believe. In fact, I'm pretty sure it's impossible.
It was supposed to be done yesterday. Done. So exactly why did I walk into my OR and still see a massive gaping hole in where the ceiling was supposed to be?
You see Karev get an 18-gauge needle and shove it in his throat.
I have cultivated a look that says I'm not interested in your personal problems. Can you morons not read that look, or have I lost the hang of it because people are telling me a lot of personal problems today?
It's a very toxic hospital.
Yeah, there's a lot of tension in the air, isn't there?
It's not really like that in our work. I mean, there is tension in some places more than
Yeah.
others, but not open like this.
Yeah. This is the type of working environments you hear about.
I mean, also British people are more reserved.
Yeah, true.
I feel like Americans are more openly aggressive if they're going to be. Whereas British people will give you side eye
Yeah.
and make it really awkward
And talk behind your back.
and talk behind your back. I think this is probably better. None of them are great, but personally, I think if you're gonna be
Yeah.
like that, just say it to my face.
Be up front, yeah.
Yeah, just
I
say
want
it
to
to
know
my
if you
face.
hate me. I don't want to find out later.
Yeah.
Crap about your crushing workload or your baffling love life or your carpal tunnel syndrome. All I care about is Mr. Root, a 92-year-old.
Hi, I'm Dr. Petman. Can I help you?
Why is the doctor at the reception?
I don't know. Dermatology, innit? It looks like they've like made it really fancy and
It
nice.
is America though.
Yeah.
So maybe, because dermatologists, I assume, make a lot of money in America.
Yeah.
Maybe they have nicer places.
Yeah, looks like it.
Yeah, it looks really nice.
If you don't mind waiting, I can get it for you myself.
Okay, sure.
Would you like some water with raspberries while you wait?
Yeah, sure.
Hi, Chris. Oh, don't mind Chris. He's our massage therapist.
You're a what?
Our hands do such delicate work, it's important that they stay healthy. So we have Chris on staff to work on us when we have a spare moment.
If you work in America and by a chance you're a dermatologist, is this a thing?
Mate, it's not.
Could it be though?
No.
Could it be a thing?
No, we couldn't. I can tell you right now it's not.
You never know. Think about how much money they earn, right? And how much do you think a hand massage therapist could cost to employ for a year?
If you think in corporate America, which is basically a hospital,
Yeah.
they're paying a hand massager, like therapist.
Think about it like this, right? Say you got 10 consultants working this
Right.
clinic, right? They're all earning $500,000,
Right.
right? Would you put in 10k each to employ a massage therapist?
But I don't think that's up to you.
Yeah, it is.
You're not in charge of the hospital.
No, but you just employ a guy.
But you're not in charge of employment.
He's employed privately through the consultant.
Most-
If you said to your management, we'll pay for it, take it out of our salary, why would they say no?
They're not going to do that, mate.
But if you're paying for it,
They're not going to. This is not.
I bet this is a thing in some hospitals in America.
Look, can
Some
someone
dermatology
just shut him up and tell him how ridiculous this is?
I bet it has happened somewhere.
No.
Every attending gets their hands massaged at work?
Oh no, the dermatology attendings have another therapist. Chris just works on the residents.
You're a resident?
First year, and loving it.
You know what this reminds me of?
So when I started radiology training, you'll be sat there and like diagnostic radiology compared to the wards is way more controlled.
Yeah.
Like you sit at a desk, you can make your own coffee.
Yeah.
You know, like the consultants are really supportive. It's busy, but even if it's busy, fine, you can just go as fast as you can kind of go. So when the FY1s and FY2s come down to discuss things, or even like the registrars sometimes, they'll be like, you're at ST2? Like,
Yeah.
And they look at you with this cup of coffee. Sat there like an aircon room on a comfortable chair. Sometimes they just look at me and they're like, man, I wish I'd done radiology.
Yeah.
And there's been a few times where they've come on taster weeks then.
Really?
Yeah.
Straight after like coming on to ask something.
I mean, it happened to me. I remember going to the radiologist for the first time being like, this is your job. Like, you mean you don't have to run around, like do 20,000 steps a day?
Yeah.
And like, you don't have to do like grunt work.
Yeah.
It was honestly, like you see it on their face when they come sometimes and they're just like, man, you've hit the jackpot.
But anyway, that was us reacting to some of the scenes from Grey's Anatomy. If you enjoyed this and want us to react to more Grey's Anatomy scenes or even an episode of Grey's Anatomy, leave a comment down below and a like on the video. But that's it from this time for us, so we'll see you guys next time.
See you later.